Now look who's the victim, lying on my table. Ring, ring, roses. You definitely fell down.
Can you hear me, my love? Can you? Well done. How are you feeling down there? Bit shaken up, are you? Let's have a quick look at those eyes. Yeah, a bit dilated, but that's all right. Excellent job. You can't remember a thing? That'll be the gas I threw into the room when you arrived. Do you remember? You came up to the 3rd floor. There was a hallway there, and you went to the end. But it did say, keep out. But you didn't, did you? No, you didn't. You silly old thing. And now you're here with me. So, all worked out in the end, didn't it? Didn't it? Oh, I'm very excited. Yes, you're looking fabulous now. Well, I think, as you appear to be in quite good spirits, actually, considering that you're all held down there, I think we should get on with the little procedure, shouldn't we? Oh, that's your lapse in memory. You came here for a little examination, and then I kidnapped you. Yes, that's right. I held you right here. Yes. And of course, you see, the problem is, the only way to incapacitate you completely was to just pop that gas in the room. But of course, I can't cope with that gas all by my little self. So I had to wait till it cleared out a little bit. Yes, I did. And I've been ever so patient, waiting for you. Haven't I? Patient little girl. Yes. Do you remember my name? Do you? Do you remember who I am? Oh, come now. Surely you can remember me. Little old Nurse Elizabeth. Surely you remember me now, don't you? Come now. Why are you being so foolish for me? I can't possibly understand what would make you be so ill-behaved. You know, I'm not keen on the ones that are so ill-behaved. I'm not, you know. They really make me cross. You don't want to make me cross, do you? I wouldn't. Not when I've got so much surgery to perform on you. Wouldn't that be a rather silly thing to do? Do you not think? I've done all the paperwork on you. I have it right here. That's right. So, I'll be getting to work on you. Lucky little thing that you are. Hello, sleepyhead. It's your angel of death looking over you. Look at you sitting there, all dishevelled. Not really sure what to do with yourself, are you? Silly old you. You don't need to do anything. You need to let me do everything for you. You know, if that little dog doesn't stop, he's going to join you on the table. I'm sure he will. Now, do you remember these little beauties? I bet you do. Let me have a little pendulum, look. Ding, ding. Ding, ding. Now, you don't have such a big mouth, so I'll pop in this little medium-sized one, and we'll just shove that dog foot. There we are. There we are. Don't make me cross. Pop that in there for you. How's that? Fitting nicely? Good. Good, good, good. Now, if it's a bit tight, I can always snip the sides of your mouth. Why don't you just let me? Come here. Oh, you're shying away from me. Just going to give you a little nip on that side. There you are. Mouth's much wider now. Isn't that better? Right. I suppose we ought to give you a little injection of sorts. That's correct. You know I've got a lovely little concoction right here that I will be injecting you with today. Yeah. Well, the main premise is it stops the blood from coagulating and it keeps you awake. So you can feel everything. Every inch of pain that you've ever caused will be transferred. I'm still going. Not quite there yet. Transferred nearly all the way back to you. Well, I'm not sure who you think you're fooling. You see, I know what you did. I know that you have been financially robbing your family for years. I know that some of your members of family could not even take it any longer. You have destroyed them. And for what? I don't see that you've done anything great with all the money that you've stolen, or the abuse that you've given out. No. You've just generally been a hideous human being, and now it's your turn for payback. Yes, it is. Now, let me talk to you about what's going to happen today. So, you get the opportunity to give back fully. I mean fully. I do mean fully. So, I'm going to take one of your kidneys today. No, we're fine without one. You only need one. We're absolutely fine. But there is another organ that I'm going to have to take also. So that might be a bit of a problem. And I don't know if you'd noticed. Have you been trying to wiggle your toes? It might be a little bit difficult. Yeah. You know why, don't you? I had to take one of your legs. Nice toes though. Don't scream! Doesn't matter, I can't hear anyway. I gave you something. Kind of close the throat up a little bit, and with that bit in your mouth, there's just no noise to be had. So why don't I get on with my surgery while you're contemplating all the misery you've caused people? It'll be one continuous sharp incision. There we are. Just going to draw that all the way down your chest cavity, sternum, through to your stomach, right down. I didn't even touch it. I wouldn't want to touch it. I don't know where that thing's been, to be perfectly honest. I did think about just taking it off, because it gets in the way a little bit. And I might yet, you know. I might yet. But we'll see. Let's get you open anyway. Let's get my saw in there and get through those bones. There you are. Oh, nearly. There we go. Lovely. Split open like a little banana, aren't you? Yeah. You don't mind if I just have a little sippy? I'm so parched, and I took quite a lot of blood samples off you earlier, so this one won't go amiss. Oh. Oh, negative, aren't you? Truthfully, I can taste it, you know. I can. Oh, that sorted me out something lovely. I can concentrate again now. I was struggling a little bit there. Now, I'm going to get my other gloves on because we're going to have to do a bit of digging around in you. Yeah, just a bit of digging about. You know how it is. Oh, you don't? No, I don't suppose you do. But you should do, because if we think about it, and it being relative, you've cracked open more than one family member's chest, haven't you? Haven't you? You've broken their heart, smashed them open, and ruined their lives. So if we look at it like that, I'm just going to get a little light on the subject. If we think about it like that, probably you know exactly what I'm doing. Don't you, darling? Right, I'm going to be digging about in you now. I was going to put a clamp on there, but I'll just push it away, it's fine. Right, okay. I'm going to need to get in again. Bear with me. Oh, is that too bright? There we are. Right, perfect. Now I can get right in there. So we're going to go first in with the kidney. Yeah, let's take that out for you. It's a bit messy around here, I've got to be honest. I'm going to have to clear up some of this blood. It's just quite a lot of blood everywhere. Oh, there it goes. Everywhere. Oh, look, it's all over you. You'll be all right, don't worry. You'll be fine. Right. Got your kidney though, didn't I? Hey? Got that out in one go. Pop. Does it hurt? Oh dear. You'll be all right, my love. Don't worry. Be fine. This needs to go on ice. Just bear with me, my love. Now, I didn't want to get you too excitable, because actually I want the blood flow pumping nicely. Now, are your chains nice and tight? Yeah, good. Good, because I think I will use my pretty little scissors for this one. I'm going to take your heart out. Ready? Here we go. Let's go in and cut around the edges. It'll be quick, I promise. Once I've cut through that main artery, there'll be no more breathing for you. There we go. Lovely. Lovely job. Now I do need you to keep the oxygen going for a moment. Oh, I don't suppose you want to, but there's no choice anymore. Keep breathing. Deep breaths. That's it. Keep breathing. I don't want to have to put the oxygen on to do it for you. Breathe. That's it. I'm just going to check your heart rate. Not too elevated, considering. Keep going. Keep breathing. All right. I am going to take your heart now. Think of it as the biggest gift you can give back for all the misery you've caused. I know in the end that's what you want, isn't it? Well, I don't really know if it's what you want, but it is what's going to happen. I'm going to have to say goodnight now, because I don't think you're going to wake up from this one. It has. It's been lovely knowing you. I wouldn't call it a pleasure as such, but still, It has been interesting knowing you. Yes. Right. Well, Wovsky now, my dear. I've got... Here it is. I've got something that needs to go on ice immediately. There. Your life wasn't in vain after all, was it? Let's put this over here. Rest up now. It's all over. And I'll drop you down at the morgue. And they'll dispose of you for me. No one need ever know of the horrific trail you left through your life. Because you've paid your penance now, haven't you? I'm going to give you the kiss from the angel of death.
Hi there, I would love to take this opportunity to say thank you so much for following along, and if you did enjoy today, if you wouldn't mind liking, maybe subscribing if you did enjoy, and also if you have time, commenting. This is a baby channel and I know you can tell I put so much love into every video, but I'm still on my journey and it's you guys that can take me there, so any help would be greatly appreciated from me. And if you would enjoy maybe some of my more explicit or adult ASMR and storytelling, there are links in my bio to my Patreon and OnlyFans pages where I would love to see you subscribe. Thank you so much, my darlings, and happy listening. Shh.